Today, for Primetime Local News, I'm joined with Dr. Cory Brooks, an associate professor at the California State University, who is studying at the University of Saskatchewan for a new promising treatment for ovarian cancer and prostate cancer. So thank you so much, Cory, for joining us here today.
Great. Thank you very much. I'm happy to be here.
So there is specific types of cancers that people know of, such as like breast cancer and prostate cancer, but not as much people know about ovarian cancer. So do you mind telling us a little bit more about this particular cancer that you are researching?
Sure. Really, we're looking at two types of cancer. One is ovarian cancer, which affects women, obviously. It's a cancer that affects the ovaries. And it's quite common. There's probably maybe like 70,000 people a year that are diagnosed with it. It's quite difficult to treat. And we're kind of related to that, even though it doesn't sound like it is pancreatic cancer. Pancreatic cancer is a little bit more rare. It affects the pancreas. And it's quite dangerous because it's rarely detected early. And currently, there's really no treatment at all for it other than surgery. So if the disease isn't caught early, it's effectively, the survival rate's only like 5%.
And can you let us know a little bit more about your study and what you guys have found concerning treatment for ovarian cancer?
Sure. So they're really complicated cancers. And like I just mentioned, there's not a ton of treatment options. There's just kind of the normal chemotherapy, radiation, and surgery, which are often not particularly effective. And so in the past, especially the past 10 years or so, there's been an explosion in this new type of treatment called immunotherapy, which is really taking your immune system proteins, these things called antibodies, and using them to treat cancer. So people are maybe a little bit familiar with this now because of COVID. One of the early treatments for COVID was an antibody treatment. And so you can use a similar type of thing to treat cancers. But the key to really making that work is the antibody drug that a company is going to make needs to basically bind and target something that is really specific for the cancer. Because you don't want the drug attacking the healthy tissue and going after the normal organs. And so what we're really looking for is a signal that is really unique and specific to the tumor. And so that's what our lab is working with. It's this protein. It's a mucin protein, which in healthy cells basically forms part of the mucus layer. And so it functions to protect the cell from bacteria, things like that. It's just kind of part of the normal healthy, makeup of a person. But what happens in both ovarian cancer and in pancreatic cancer is that protein is modified in a bunch of different ways. And one thing that happens is there's less sugar attached to the protein, and that makes it a unique cancer signature that can be targeted. And so what we did was we actually mapped the three-dimensional structure of that protein. So we know the position of every single atom in that protein and where all the different cancer-related signals are attached to that protein. And so now we're working with a couple different labs to try to make antibody drugs that specifically bind this cancer-related protein.
And you guys are studying at the University of Saskatchewan. So how has this university been able to help you guys with your study?
So the technique that we use to look at the 3D structures of proteins, that requires very specialized instruments, a facility called a synchrotron. And Saskatoon has the only one in Canada. And they're these large particle accelerators. So it's this large building kind of out at the edge of campus. And it has a giant magnet that is spinning particles at the speed of light around in a circle. And the energy produced by that is brighter than the sun. And we actually use that energy. We kind of siphon off a beam of that and use that to figure out the three-dimensional structures of our proteins.
You are working on a treatment that might be a lot less harsh on the body than, say, chemotherapy is for many cancer patients. So how important do you feel that this research continues so you guys are able to make this treatment a reality for ovarian cancer patients?
Yeah, immunotherapy, I think, has a lot of promise going forward. It is unlike, so the chemotherapy, radiation therapy is very non-specific. It basically is killing all kinds of healthy cells, which is why the side effects are so horrible, right? The reason why people's hair fall out is because the radiation is killing the follicle cells in the head. Antibodies, because they're so specific, really have the promise to reduce side effects. And there's been several types of cancer where antibodies have made a really big difference. They're quite popular now with treating breast cancer. It's a drug called Herceptin. So there's a ton of research going on to try and make these new therapies for all kinds of cancers.
Well, thank you for joining us, Cory. It's been a pleasure.
Okay, thank you very much.